So thank you for coming. So what does public policy, what does politics have to do with the work that we do every day? And really, it's in everything. Everything that we do involves politics. Certainly working for the government or getting a government grant, applying for a government grant, you have to maneuver through bureaucracies and sort of learn how to move through to get your project funded, to get it implemented, to get it out there for the community. And certainly, even clients have to deal with sort of the politics of the areas that we're in. Clients who want to access syringe exchange, for example, they have to deal with sort of the local politics. Clients more recently who want to access PrEP services have to deal with sort of the politics that are put out there by different people. And so we have to figure out a way to sort of help them go through that. So I'm gonna talk about the AIDS Coordinator's Office white paper. This is a document that sort of it was a framework for us to work with and sort of develop programs and develop different initiatives for the city specifically. So the office, so I'm going to attempt to do this in 5 slides within the time that I was given and 10 years worth of information that I'm going to be accessing in my head as I talk. So
I have time to go to the bathroom then, right? Perfect. I'm going to use the restroom. I'll come back.
Okay, I'll try to keep talking. So this office was established in 1989 by Mayor Tom Bradley. It was really a time when there was nothing out there for people living with HIV. People were basically just dying. We were trying to do what we could, but it wasn't working up to that point. The office was established specifically to focus on sort of the city family and try to develop policies so that we could help city employees and their families deal with HIV. So the first sort of 10 to 13 years, we sort of focused on that. We went from here to there, developing policies for our internal purposes. When Mayor Hahn came in, he wanted to start focusing more outwardly and wanted to help us develop a sort of framework to keep going forward, which is this white paper. He put together a team of people from the community, so providers, clients, academics, to come together to talk about HIV and how the city could make an impact. We're not a health department, we're pure policy work. We do fund programs, but it's not the same as the health department. So the AIDS Leadership Council came together for about a year. They put together this white paper that really had 3 main goals that they wanted us to focus on. Prevention, so they wanted us to look at different interventions that we could fund. They wanted us to really work closely with the county and other partners, something that we really hadn't done up until that point, and do better coordination. They wanted us to focus on stigma and discrimination, and that was, sort of very big. Like, how do you do that? Back in 2002, there wasn't as much information or research on stigma and discrimination as there is now, so it was something that we really had to think about when we started doing that type of work. And then housing and support services. So the city gets funded for the HOPWA program, and there really hasn't ever been much coordination between the AIDS Coordinator's Office and the HOPWA office. And certainly the same with sort of our county counterparts. So some of over the years we did a lot of stuff, and so these are some of the achievements that we did over the past decade. We started funding harm reduction programs, so we've been funding syringe exchange in the city since 1994. We really got a lot more sort of sophisticated and more funding allocated to that program once this framework was put together and we were sort of given a mandate to go do this. We started looking at the cofactors that lead to HIV. This is something that we're talking a lot more now. This was sort of in the beginning. So what we did was sort of fund studies. So we funded transgender studies. We funded studies that looked at risk behaviors among gang-affiliated youth. We looked at how women were getting infected and how they were sort of living their lives living with HIV. We started doing work around opt-out HIV testing. We held a few housing summits. Actually, one was here. We brought together leaders of hospitals and administrators and CEOs and legal departments to come and talk about the work that they were doing with HIV and see if we couldn't convince them to start, doing routine opt-out testing. We funded, of course, prevention projects, health education, risk reduction programs, community-level interventions, individual-level interventions. We tried to do programs that weren't necessarily being funded by anyone else in the county. And then we did community forums to educate and create partnerships. An example of one is today. We worked closely with the county on the commercial sex venue ordinance. That is the ordinance that required the bathhouses and sex clubs to provide condoms, provide HIV testing and HIV information to clients who access the services. Advocating, the advocacy part of it, we worked in collaboration with, the county, the state, the HIV Commission to do all sorts of HIV testing work to make it easier for people to get an HIV test. We went back to our roots and we updated the sort of internal HIV discrimination employment policy that the city had. We updated that about 4 years ago to take into account all the changes that have happened in HIV. Of course, when we developed the first one, the drugs were not around. The interventions that we're seeing now, the biomedical interventions, were not available. So we wanted to make sure that this policy was inclusive and that it also took into account the sort of policy changes statewide that have happened since that first one. And then we've done lots of research projects. We did some of the first, we co-funded some of the first sort of biomedical PEP and PrEP studies that happened in LA. We did the Grindr studies. We're currently doing a study looking at sort of employment for the transgender community, working with the Workforce Investment Board and the different workforce centers in Los Angeles to see how inclusive they are in terms of their policies and in terms of hiring and keeping the transgender community employed. And so the other thing that we're doing is trying to update this white paper. So again, it's about 12 years old now. We've been holding sort of one-on-one interviews. We had a community forum with the mayor about a month ago and doing internet surveys to look at how we can update this, bring it up to date, get in line with the National AIDS Strategy, get in line with the ACA and see how we fit into the new way of HIV here in LA. Some of the feedback that we've been getting is sort of the stuff that you'd expect. They want us to focus on young gay and bisexual men, other underrepresented groups like transgender women, Native Americans, sex workers, substance users, high school youth, people of unknown status, and people who are newly diagnosed. They want us, in terms of activities, they want us to focus more on biomedical interventions, more HIV testing, particularly in training staff of clinics and hospitals on how to routinize the testing within their facilities. And this is actually a project that we've been funding for the past 3 years within a few different clinics, just trying to figure out different ways of training the staff to get them to offer the test automatically to anyone who walks in the door. And a few of them are actually managing to test about 1,000 people a month. So we think it's been very successful. Not too many positives, but at least we're training the staff. We're getting the word out to the community that HIV testing is not a big deal, and that they should do it. That they should get tested often. They want us to expand the syringe exchange program. They want us to be a little bit more innovative with what we've been funding. Of course, we are restricted by the politics of the program itself. We can't provide federal funding to that program. Recently, we were allocated general funds, so we're going to be able to be a little bit more flexible with that program. They want us to take a stand on PEP and PrEP. They want us to do more to engage the HOPWOC program and support more programs that look at these cofactors like stigma. And that's what I have. And so hopefully I can answer some questions.